my privacy. Wash my hands. Hi, my name is Alma and I'm going to be your student nurse today. Can you tell me your name and date of birth? Okay, today I'm going to be changing your wound dressing. My patient's bed is in the lowest locked position. Her collar is within reach and she's wearing non-slip footwear. Like I said, I'm going to be taking your dressing off, cleaning your wound, and then reapplying a dressing. Do you have any questions or concerns? No? Okay. And are you in any pain today? No? Okay. I'm just gonna make sure that you're in the most comfortable position for me to be doing your dressing change. All right. Now I'm going to wash my hands and put gloves on. I'm going to check the provider order before I start. Okay. So I'm going to begin by just taking this dressing off. I'm going to use the push-pull method. Okay, and then looking at this dressing, there's no odor or drainage, so I'm going to dispose of this per institutional policy. And there's no odor or drainage on these ones either, so I'm going to dispose of them. Now I'm just going to take a look at your wound here. I'm not seeing any signs of infections. There's no odor or drainage, and it's a little red on the peri-wound area, but that's normal. When a wound is healing, the edges are well approximated, so it looks to be healing up pretty good. I'm going to measure it now. So I have a length of 14, a width of 2.5, and then I would use this cotton tipped applicator, and it's about 2 inches deep. Now I'm going to wash my hands again. And I'm going to prepare my supplies. And I will prepare my tape. Okay. I'm going to date and initial. Alrighty. Now I'm going to put gloves on and wash my hands again. Alright. Now I'm going to begin cleaning your wound. I'm going to take the 4 corners And be sure to only use one swipe for each gauze pad. We'll do the outer edge. The other side. Now we'll do the peri wound. Other side. Okay. And if there were any medications to administer, I would administer them now with the 3 checks and the 11 rights. I am now going to dispose of my gloves and wash my hands again. Now I will put clean gloves on, and I'm going to pack the wound and put the dressing on. So if there were a lot of drainage, I would use more than 1 gauze pad, but since there was no drainage on the last dressing, I'm just going to use 1. Now we'll put the dressing on. And we're going to use the window pane method. Okay, so now I would just document that we changed the dressing, and then I would assess to make sure my patient isn't experiencing any pain or anything else. And then I'm going to wash my hands and thank my patient.